You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. G on tips for caring for geriatric dogs. Welcome.
Thank you, Polly. It's a pleasure to be here. Thank you for inviting me.
Yes, thanks for being on the podcast. And I have a senior dog, and I thought it would be very important for the listeners to hear on how do you really care for a geriatric dog?
Great topic, pertinent to a lot of people in the country. I have basically 5 major bullets or 5 major points that I think go into synergistically caring for a senior dog. Number 1 on my list is weight management. We can call it weight loss, weight control, weight management, but it's so important for our older dog population to not be overweight, because that's just extra work that all the body tissues have to do, especially the joints, the muscles, and the heart. So either keeping your dog slim before he or she becomes a senior, or if they're a senior and they're carrying a few extra pounds, now is the time to really speak to your veterinary care professional and figure out what is the best way for you to normalize the weight for that dog. That's really the mainstay. If we have a normal weight dog, that dog is going to experience less pain, and that dog is going to be more mobile, and that dog is going to ultimately require less medications on all different fronts. So that's a huge one from where I sit. Next on my list is, as you may sort of intuit, I'm not sure, but having a regular exercise regimen for the senior dogs, I think, is vital to keeping them vital. You've probably heard the term use it or lose it, right? So if we have senior patients that are going through, just like humans as they age, we lose muscle mass, and it's medically known as sarcopenia, but we want to keep that muscle mass at its optimum and at its maximum that we can. We want to keep those joints fluid. We want to keep the muscles toned. So exercising your senior dog on a regular basis, I think, is critical. And what I mean by exercise, I think that older dogs should be less inclined to play fetch with a Frisbee or with a ball, or chase you around the backyard, just because that's more concussive and it's harder on the joints. And so they're more apt to acquire injuries. I think the best form of exercise for geriatric dogs is a nice, steady, fairly brisk-paced walk, anywhere from a half a mile to several miles, depending upon the breed that you have and where you live in the country. Daily, ideally, and flat surface. So we're not going rock climbing and mountain climbing, but, a nice, steady sidewalk walk several times around the block is an excellent way to keep your senior dog fit and in shape. And also that was going to help, number 1, which is the whole concept of weight loss. One side note, depending upon where you live, be mindful of your temperatures, either too hot or too cold, of when you're going to be walking your dogs, so that you're not stressing them either from too much heat or if it's super cold, they need to be dressed appropriately.
So with my dogs, they're on like a set schedule. If we don't start walking at a certain time, they start
Getting antsy.
pacing around. Yeah. And a morning and afternoon walk. And my senior black lab, when we walk too far, it's almost like she trips over her paws. I mean, so I get home because I think her joints is that because of her joints being tired?
I'm not sure if it's her joints being tired, her muscles being fatigued, or just her whole system being taxed. I think that specifically for the geriatric patient category, they kind of need to tell you how far they can go versus what's too much, right? Which is why I said anywhere from a half a mile to several miles, because it depends on the breed. It depends where you live. It depends if they're overweight or normal weight. It depends on what other conditions they have. So I usually tell people, like, if you're halfway through your walk and your dog's already tired, you need to shorten your walk by 50% so that your dog can get there and get home without you either dragging the dog or carrying the dog, depending.
Yeah. So I'm sure diet has a lot to do with making sure that geriatric dogs keep their weight off.
Yes. So it's both qualitative and quantitative, right? So you are what you eat. So if your dog eats dog food, that's kind of what I consider to be fast food dog food. That's not going to ultimately lead to a healthful body system, and it's going to make nutritional complementation harder for that dog. She's going to be more hungry, wanting to eat more, not because she needs more calories, but because she needs more nutrients. Okay. I mean, hunger is hunger. And oftentimes we misinterpret hunger means I need more calories, but sometimes hunger means I don't have the right nutrients. And so I just need you to feed me more. So quality of the dog food is incredibly important. So I generally recommend I recommend this to all my patients, but specifically the geriatrics, that they feed a high-end brand. I'm not going to name brands on the podcast there's so many. And I would say generally go back to your veterinary healthcare team, talk to your veterinarian, what foods are considered quality foods and appropriate for geriatrics, but diet in and of itself absolutely makes a difference, both in terms of weight loss, weight control, and nutritional completeness. So that's my third big item on the list. My fourth item is, let's supplement the dog based on that dog's individual needs. And there are some general supplements that I think all dogs should have. And then I think that there are supplements specifically suited for the geriatric population. So starting with the benefits of fish oil in terms of omega-3 fatty acids as being anti-inflammatory, I think that's an excellent all-around wellness supplement for geriatric dogs to help them fight off the degenerative processes that are happening and the inflammation that's resulting in the body. And it's very important that you select a clean product that's properly sourced and third-party tested for purity. Then there are joint and bone supplements. And I think most of us are familiar with those because they have been around for a long time. So things that are going to keep you mobile, they have glucosamine and chondroitin in them. There's many, many different brands out there. Most of them are pretty good. And again, I'm going to say, go back to your veterinarian, speak to your veterinarian about which particular ones. There's lots to pick from: VRS, Myos, Dosequin, Cosequin. But that's not the end of the story. Okay. There's also support for muscle tissue. And I think this has been terribly underrepresented. Historically, we haven't had a lot to offer our patients. I am going to name a particular product by name because it's unique in its category and it's a new kid on the block. It's called Myos Muscle Support. It comes as a solo agent or in combination with others, but bones and joints don't operate in a vacuum by themselves. And we all know that as we age, we lose muscle tissue. And so making sure that we optimize vital muscles and that we maintain as much muscle tissue as we can is incredibly important. And so the combination of all of these supplements together, again, synergistically work. It's like having a giant toolbox with multiple tools in there to get the job done. You can't always get it done with just one thing. So using the muscle supplement Myos, I think, is very important for the geriatric patients. And then I think that using something for cognitive function and sort of brain support is also really important, because a lot of our older dogs start to get a little dull or a little senile in their mental capacities, their vision dulls, their hearing dulls, their smell dulls, and they're not the brightest bulb in the chandelier. And so helping them to stay alert and cognitively lucid is really important as well. And so I would definitely recommend that people include a brain support for their dog before they start to see the brain decline or the mental decline.
So what do you consider a senior or geriatric dog? At what age?
So it depends on the breed. So the really large dogs like Great Danes and Newfies, Bernese Mountain Dogs, they're going to be seniors sooner. So I'm going to say 7-ish already. I'm looking at them as pretty advanced. And then you have the other end of the spectrum with the Poodles and the Maltese and the teacup Yorkies. I might not really look at them as senior until they're closer to 9, because they're going to outlive the giant breed dogs. So somewhere in that 7 to 9, 10 at the outset zone, depending upon the breed that you have. So your dog at 10, Maddie at 10, is definitely in the senior category.
Okay. And most veterinarian clinics will have a combination of these drugs.
Yeah.
And vitamin?
Correct. So I really like to, so this is what I call the support stuff, right? I'm not putting you on pharmacology. I'm really trying to help you I'm suggesting to be as preventative and as supportive as possible. Use all of these things in combination. And then this will kind of ensure the greatest longevity for your senior dog, as well as the greatest quality of that longevity. I do have one other category. I don't know what to call it. I call it the comfy home and environmental enrichment, right? So things that you want to make sure for your senior dog. Number one, they want to have secure footing in the house. So if you have slippery surfaces, you want to put something there so that they don't slip and trip and fall, especially going up and down the stairs. So if you have wooden staircases, you might want to somehow reinforce them so that the dog has good gripping going up and down. You want to make sure that you engage in some kind of play with the dog. So my favorite is playing hide and seek, where you teach the dog where you go into the house and you hide little food items or treats, and then the dog has to go and find them, right? That keeps them curious, active, sniffing, doing something. I think it's really awesome to use food reward or food release toys, where the dog has to manipulate the object in order to get the treat or to even get fed that way. That's very mentally stimulating, and it makes the dog do something physically with his or her paws. And then sometimes I say, look, get another dog, right? Because then that dog is going to have someone to play with. So keeping that home environment stimulating to the dog and safe by making sure that it's skid and slid proof and trip proof, I think go a long way towards, again, both extending longevity and the quality of that life. So those are my major categories on this topic.
Those are great tips. Thank you for being on the podcast, and we look forward to having you back.
You are so welcome. It's been my pleasure. Thank you for having me.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.